I'm going to tell you briefly what type 2 diabetes is and how the vast majority of people can reverse it in a very short time. Type 2 diabetes, in a nutshell, is the body being insulin resistant due to producing too much insulin, due to eating too many carbs, and possibly eating too frequently. The body can become numb to the effects of insulin when it produces too much for too long, just like it builds a tolerance to other substances like alcohol, where you have to take more to get the same effect. Most doctors tell their patients that type 2 diabetes is a chronic and progressive disease, and that the best they can hope for is to take medication in an attempt to fend it off until the body inevitably succumbs to the disease and you get all the horrible consequences. The reason it's seen to be a chronic and progressive disease is because the model of giving people more and more medication does nothing to treat the root cause of the disease by lowering the amount of sugar and insulin in the body. Medical professionals don't tend to go against the grain, and they normally say what they're told to say because they have too much on the line for themselves. They have well-paid jobs, prestige, clout, mortgages, and of course, they may even have huge student debt from obtaining those qualifications in the first place. Type 2 diabetes is simply consuming too many carbs, which then produces too much insulin, making the body insulin resistant. Therefore, the only logical treatment for that is to eat a low-carb diet, such as the keto, carnivore, or paleo diet, and if you can, to include some intermittent fasting as well. If you're not eating carbs, it will be impossible to have too much sugar in the body or the blood. If you're eating less frequently, the body will have an easier time resetting its insulin levels because you're also going to be producing less insulin by consuming less proteins and less fats. Not to mention that as you begin to lose your excess weight, the body will have an easier time utilizing the insulin it does produce as it learns to become insulin sensitive again. If you're wondering if you're going to have low blood sugar levels by not eating carbohydrates, the answer is no, because as a type 2 diabetic, your body will still be able to produce the amount of sugar it needs in the blood through a process called gluconeogenesis. And your body will also be able to self-regulate the amount of insulin it produces as well. Click subscribe if you'd like to see more videos like this, and thanks for watching.